Hello, Uganda. My name is Mwanguzi Shadrack from Health Touch Uganda. Today I'm going to be talking about nose bleeding and some of the things that you should do at home just in case you experience something like that or a person you stay with experiences that. Nose bleeding is common in some people. Today we shall not go deep into what causes it, but I'm going to only be talking about the first aid that you can give to a person who is bleeding, and also tell you some of those things that are not good to do. So when a person starts bleeding from the nose, it's important that they sit upright. When you sit upright, the amount of blood in those blood vessels around the nose will reduce, and so that helps in discouraging more bleeding. After sitting upright, try to lean forward. When you lean forward, it prevents this blood to flow back into your throat. We don't want this blood to collect in your throat. Some of it you may swallow, some of it may go in the lungs and cause other problems. So sit upright and lean forward. That kind of move helps in one, reducing the amount of blood in those blood vessels around the nose, and also prevents the backflow of this blood into the throat. Then after, try to blow out gently the blood that has collected in the nose. You can easily, some people bleed from both nostrils and others only bleed from one. If it's only one bleeding, you can know, and you try to put some pressure. If they are both bleeding, you can put pressure on the two of them. The kind of pressure I'm talking about, get your two fingers, the thumb and the index finger, and put them around here. We call them the ala of the nose, and press or apply some pressure. That helps in minimizing the bleeding. Over time, we do this for between 10 to 15 minutes, and in most people the bleeding stops right away. So just get your two fingers, the thumb and the index finger, put them on the sides of the nose around here and press. Do that for over 10 to 15 minutes while you are breathing through the mouth. And when the bleeding stops, clean yourself. If it doesn't stop, or if it stops and resumes shortly, do the same thing. If it continues even after trying over and over, please make sure you rush to hospital or to a health facility, because you may need some more intervention. Make sure you don't put things in the nose, sponge, cotton, or any other thing. Don't put anything in the nose. Just do that pressing. Just apply that pressure. The bleeding will stop. Some people have always been lying down. They tell someone, lie down flat on your back. That is not good, because that blood will flow back and cause other issues. Don't try to pick the nose. Those things of trying to remove maybe the clothes or don't try to pick the nose at that time when it is bleeding, or even after it has stopped bleeding. When it has stopped bleeding, some of the things you need to do is to, when you're resting or when you're sleeping, make sure your head is raised. Maybe you can put a pillow. If you can raise the end of your bed, the better, so that your head is at the position above the level of the heart. And avoid engaging in strenuous activities like exercising for at least 12 to 24 hours, because you may bleed again. Also, it's important to avoid touching your nose as much as possible, because it may bleed again. So minimize touching your nose. Don't engage in physical activities or any other strenuous activities for at least 12 to 24 hours, and make sure you sleep. When you're sleeping, your head is raised above the level of your heart. So put a pillow or raise the end of your bed if it can. Mwanguzi Shadrack,